biggest core value is getting to the root cause of why someone's having pain, teaching them the right exercises and fixing the movement patterns to really get them long-term results. I love doing these types of workshops because it really allows us to teach you guys some of the things that most healthcare providers miss to get us better results. So when it comes to running, I'm not a runner, but I'm good at it because I know how to do it. Most people run incorrectly, they land on their heels, they don't know how to use their feet, and they're lacking hip stability. So that's the biggest thing we see with runners is we have big squishy shoe, and that doesn't allow their brain to properly connect to the ground. So when you start to think of running shoes and you start to think of arch support, Hoka's are terrible, On Clouds, Brooks, the more support we put underneath the foot, the weaker it gets, right? It's kind of like, people don't think of it like that. They think, oh, I'm gonna run, I need support for my foot, and this and this. But the more support we give it, the less it's able to do its job. It's kind of like if you broke a bone, we cast an arm, or we break our wrist, we cast it. 6 weeks later, we take the cast off, and the arm is atrophied. It's smaller, it's weaker. The muscles, the tendons, the ligaments, everything's just weaker. It's the same thing with a foot and ankle. Whenever we put a big squishy shoe underneath our foot and ankle, you're essentially casting your foot all day. And then if you go to run on a weak foot, you're going to compensate somewhere else. Where we compensate, we get pain. 95% of the time where we're having pain is not the real problem, unless you've fallen, break your hands on a mountain bike.
There's that.
Right? That is like, yeah, it hurts here because I just broke this. But if we have some sort of like insidious, like every time I run, my lower back hurts, or my knees hurt, or every time I go to deadlift, like I feel like I'm gonna throw out my lower back. Most of the time, it's not a lower back problem. It is something somewhere else that's not working. Or runners, or just people using lower body. If my foot does not work as it should, and it's not a strong, springy structure, my knees are just gonna get beat up because they have to compensate for the foot not doing its job. So, runner, do you run much? No?
Try not to.
Try not to. Is it irritate your back or anything?
No, I'm done.
Just done with it? Okay. Okay. And then we talked, you used to run.
Yeah.
Were you a heel striker or forefoot?
A little bit of both. Like I would alternate between both.
Okay.
Just whatever was more comfortable for the terrain, but probably more forefoot.
Okay, that's good. It's funny because people come in and they think running is high impact. And it is if you do it wrong, right? If you do it the right way, it's definitely not. And most people tend to be heel strikers, so they turn a movement pattern that for us as humans is really innate and ingrained, and they make it worse because they put big squishy heel underneath their foot. They've got arch support, and so if we have the heel, if we're wearing a shoe where the heel is lifted like this, and we have arch support, it's literally going to force you to run and land on the heel as you roll through. Now, you can run like that for a little bit, but over time it's just going to beat up the joints. And so the best thing I kind of think of, if I were to slam my heel into the ground here, right, all of that impact is going into the bones, it's going into the joints, and eventually my knee's going to get pissed. If I have a squishy shoe underneath it, I can probably do this a couple hundred times and be fine. But if I take my shoes off or wear something like this, I'm immediately going to get that feedback loop. So proper running form, we should be landing on the forefoot. The heel should be lowering, and then it should be springing back up. So we want to take that impact from here and switch it to this. The foot and ankle is one of the only places in our body where we actually get a mechanical advantage. So all of our joints are just levers, right? I pull my arm up, the bicep pulls on the bone, and that allows me to lift the weight. most of our joints are also give us a mechanical disadvantage for the sake of range of motion, right? Bicep attaches here and it pulls my arm up. If my arm is really long, it makes me weaker because that moment arm. What's nice about the foot and ankle, it's the only lever that does the opposite. So think of a wheelbarrow. If I am lifting a wheelbarrow, I have a giant heavy rock. There is the wheel in the front and then me lifting it up. It allows me to lift that giant heavy rock. It gives me a mechanical advantage. Your foot is the same exact lever, where the ball of the foot is the wheel. Big heavy rock is right here. That's my weight over top of the foot. And then the lifting force is the Achilles tendon lifting the foot up like this. Whenever we support the foot with a whole ton of arch support and squishiness, we lose a lot of the mechanical advantage that we have innately built into our system. Does that make sense? It takes time to learn the new running pattern, but whenever we actually do, running becomes much easier. I used to hate running. Like I grew up playing hockey. If I went and ran, I hated it because like it just felt awkward. And then once I learned proper running form, I'm not a runner, but like I can go and do it pretty well, and it doesn't piss anything off because we understand how to actually land on forefoot, load that lever, and then create motion from there. If I'm gonna run, these are my running shoes. Running these, hiking them. I mean, I take classes, I basically just take them now. All things are always in these shoes because it allows my foot to work like a foot. Strengthening the foot and ankle is personally as a clinician, one of my favorite things because it translates so well to so many other things, right? If you wanted to like run around with your dog or come in here or go and play a game of flag football or anything like that. If I have this really strong foot and ankle that can respond well to moving and generate force from the ground, everything else becomes much easier. So, what questions do you guys have so far? None?
Yeah, I'm good. Good
Okay.
for now.
Good for now, okay. Cool.
He was talking to me.
As we go through too, like please ask questions if you have. That makes it way more fun because we can like dive deeper into those. So, we're gonna get into some exercises. We're gonna do foot and ankle exercises. It is important during a foot and ankle exercise to go slow.
That's just kidding. Oh, she's coming in hot.
Hello. We've been waiting for you.
Have you really?
Is everyone ready to start now?
I brought my whole Target cart with me.
Yeah, I see that. It looks like you're stealing the cart.
Listen, it's been a busy day, but I'm here.
We're here.
Okay.
Okay. Okay. So, we're gonna get into some foot and ankle exercises. We talked a lot about foot and ankle, how it's important for running, and how we go from there. So yeah, shoes off, socks off if you'd like, and we're gonna get into some exercises. So, first off, we have to understand there's 3 arches in the foot. People only really think of the one that they can see. The 3 arches go between the heel, the big toe knuckle, and the little toe knuckle. These 3 arches create a tripod. That tripod is important that it all works together. Most of the time with my runners, what we find is they run on the outsides of their feet.
I already know. I'm like, even just sitting here, I'm lifting off that toe's always coming off the ground. So I know that's probably my downfall.
Yeah. And so, if you think about it, right, if I go and run, I do a couple thousand steps, and every step is out on the edge of my foot, my knee's gonna get beat to shit. And so what happens is this creates a lot of kneecap tracking issues, right? So, kneecap, right here. This is our classic runner's knee, and it's usually because they run on the edges of their feet and they have weak feet. what happens if we think of this kneecap, imagine that it kind of sits in this little groove like this. And that kneecap should slide and glide right in the middle of that groove. If we're overloading one side of the leg, it's usually the outside, kneecap starts to pull into the side of the knee like this, and it starts to rub. And this is where the noise comes in. Whenever you bend your knee and you just hear like, right? People tend to like laugh and joke like, oh, listen to my knee, it sounds so crazy. Me as a clinician, I'm like, it's funny, but also that turns into a knee replacement.
Is that what that means?
Yeah.
Okay.
Does your knee do that?
Not mine. One of my clients yesterday, she was joking. She was like, listen to my knee. And it was just brutal.
Yeah.
Like what they call bubble wrap almost.
Yeah. So there's joints called facet joints. They slide and glide like this.
Okay.
And that's what your kneecap does over the leg bones. And so whenever we hear a lot of that crepitus, it is that joint getting jammed together, and as they bend and straighten, it's just getting chewy shit.
Okay.
It's whenever I say knee replacement, it's not like everyone's like,
I'm like, yeah, that's it.
80 million
Not today,
stretcher
but
lifts
there are
later.
and it's not like, this isn't I don't like to doom scare, right? Like, oh, it has to be replaced, but over time, more and more of that turns into more and more pain, the joint gets beat up, and eventually it's like, it's beat up too bad now, now we actually have to replace it. You can take a kneecap and pull it back to the middle and get it tracking the right way with the right series of exercises.
So that is what that means, that it's off its track?
Yes.
Okay, so
Yeah.
it's not like unfixable?
No, it's not unfixable.
Okay.
No. And that's a great point. I had a patient come in, met her at Burn. She came in with that same knee tracking pattern. And she had been to an ortho, and the ortho basically told her like, oh, there's nothing you can do about it. Like, you're just gonna eventually have to get it replaced and this, and she had stopped. She had stopped running, she couldn't really lunge without pain, going upstairs sucked. And when we checked, yeah, her kneecap was just like jamming into the side of the outside of her leg. Once we rebalance the knee starts, one, first feeling better, two, eventually the noise gets less and less, and then three, now all of a sudden this glides, and we avoid not only the knee replacement, but I also think about the ups and downs of knee pain in the next 20 years, right? If she has 20 years to a replacement, it's not like this feels great, and then all of a sudden we're like, okay, let's get it replaced. It's like, oh, now I can't run. Now I can't enjoy my workouts. Now this. Now it's so bad I have to get it replaced. It is so much easier here to just fix it here and just tweak this, and it avoids all of those things.
Okay.
So what we're gonna do is we're gonna do some foot and ankle exercises. To start, we'll do some lateral hip stability exercises. And again, so we're thinking three points of the foot. The heel, little toe knuckle, big toe knuckle. These 3 points create this tripod. We want this tripod to be nice and equal and strong. And so, if I'm standing here and we're just looking at the right leg, if I let this arch drop, see what happens to the entire leg. Strong arch, weak arch. Strong arch, weak arch. And it doesn't, if I'm just standing here with that arch collapsed, you probably wouldn't notice it. But what's happening is my leg is rotating in, and my kneecap is gonna start getting jammed out this way. And then I go and run on a foot that is collapsing in like this, and I start getting knee pain. You can stretch your knees or massage it or dry needle it all day till the cows come home. It'll make it feel better, but it won't actually get better until we address the root cause. Questions?
So like you can see like ridiculously flat-footed. So my feet tend to inverse.
Yeah.
And so I get outside knee pain when I run, up to my hips. Is that why?
For sure. Because what happens is whenever our arch collapses in, people tend not to run on the insides of this collapsed arch.
Right.
They overcompensate and they shift their weight out.
That makes sense, yeah.
And now we're overloading lateral line of the leg. It creates an IT band issue. It makes it harder for us to engage our glute. And then that kneecap just starts getting pulled out this way until it gets worse and worse. You can rebuild arches, right? It's not like people think like, I have flat feet. It's like saying you have dark hair. Like, it's a muscle that you can actually rebuild.
I didn't know that.
Yeah.
So if you're flat-footed, you have like a muscle imbalance essentially?
Mm-hmm.
Oh, okay.
Most of the time we find people with flat feet have weak feet. So the arches aren't supporting and building
That
up.
makes so much sense.
I have a lot of patients. One specifically recently, she was like, "That sounds weird. Do you have any pictures of my feet whenever we first started?" I was like, "I do not," because her foot is physically changed. Right, the arch is built, toes have started to spread out. My foot from years of hockey used to look like this.
My dad's foot looks like that from hockey.
Yeah.
His toes like do this weird.
Yeah, you're just jamming them in skates. This is why I wear my Air Jesus sandals, because it allows the foot to open, to be strong. And like you guys know, I work out barefoot, so.
We're all gonna have to go get pedicures and get those little foam slippers that they get.
Yes.
Flat foam. I'm sorry, Air Jesus too.
There we go.
That's gonna be our ear Jesus.
There we go.
Yeah, I was just admiring your Tito's.
So.
Yeah, those are actually
Jump on
really
my
well.
I'm gonna get a haircut.
Okay. First exercise we're gonna do is one of my favorites to start people on to find those 3 arches. We're gonna use a kettlebell. Let me demo first, and we wanna make sure we're not on the turf, but we're on harder ground. So, first, I'm gonna lift the toes, I'm gonna lift the heel, and then I'm gonna try and put the toes back down. My hips are square, and I'm just gonna take and load as much weight onto that leg comfortably as I can. So what we're trying to do is feel equal pressure across the balls of the feet, almost like this is gripping into the ground here. And we're gonna take about 30 seconds. So let's just try without the weight first, and then I'll show you with the kettlebell. So again, we're toes up, keep the toes up and feel the heel up, and then spread the toes as we put the toes back down. So we want to feel the ball of the foot. My heel is just barely hovering off the ground, and my hips, it's like I'm taking a bow. We're doing a little mini hip hinge. You control how much weight you put on that front leg. Keep the knees slightly bent. We might start at a 50-50 split. We might skip more and more. Eventually, we want to be able to lift that leg and feel the arch of the foot working. Take it slow. Good. Switch sides. Yeah, so keep that back foot down. You just want to go as far as you can while being able to maintain. Lift that up. Yeah, lift. Good. Keep that down as you lift it up, and then lift that heel. There you go. Feel that working through there? Perfect.
See, in my issue, I feel it up into my glutes, like,
Good.
that's where I'm supposed to feel it, but I feel like,
Yes. Yeah. Getting you.
Ooh, I feel it out here.
Okay. We're gonna. You feel out there
I'm
too.
feeling, yeah, here.
Yeah.
So we're gonna find the other side of this with it.
Like you're imbalanced.
It's okay. So that's just telling us you're probably brain is used to finding for you two out here.
Yeah.
We should be feeling this into the glute, so
Okay,
that's
so
good.
that feels good.
I feel it in like my glute knee.
Okay.
I feel some glue, but then it over the time, like I start.
Yeah.
Over into here.
Okay.
Cause it starts
Which
here.
is funny because that's
Good.
exactly where I have pain when I run.
There.
Like right
On the
here.
outside.
Yeah, the outside.
Yeah. Okay. So just holding this without any weight, your brain is going to want to go to what it's good at, and for y'all, it's going to be this outside. What we're going to do is we're going to have kettlebell. So kettlebell, first and foremost, hips square, my heels lifted, and then I'm taking this little hinge. My knee should be above my midfoot. Remember, we talked about that lever.
There
Like,
goes my knee out to the right.
So and I'm taking this hip hinge. We're trying to connect foot activation to high hamstring, high glute, or low glute. What we're gonna do with the kettlebell is I'm going to slowly, first I'm gonna find this position, I'm gonna slowly pass left and right. Eventually, this gets quicker, and eventually we have almost no weight on the back foot. This is a very challenging exercise. Doesn't look that difficult, but a lot of lateral stability is happening with the ankle and foot as I pass left and right. So, grab a lightweight, probably 6 to 8 kg, and you're gonna do about 30 seconds per side. Yes. So, and I'll kind of cue you into it. Hips are square. We're just hovering that front foot. Back foot can be lifted too. Yep. And then I'm taking that bow, right? My butt reaches back. My knee stays over the midfoot. And we should feel arch working in combination. Yeah, with the glute and hamstring. So just support yourself as much as you need. And what you're gonna find is that that pass is really gonna start to fire up the foot and ankle. Good. And take a break, switch sides. How'd that feel?
Feeling like I already ran this morning and walked dogs.
I feel like here.
Perfect. Good to go.
Is
We'll
that
talk
good?
about that. Yeah.
Okay.
I feel more interior to the elbows.
Okay. That is one of the arch support muscles. Focus on pushing the ball of the foot down,
Wow.
not on lifting it up. So heel's gonna be, yeah, there you go. Heel's just hovering. Yeah, you're pushing the ball of the foot down as if you were doing like a calf raise.
Oh, wow.
You're trying to lift the arch up, yeah.
This side, I am having a huge balance issues, like I really.
Is this the side you get more symptoms on?
Yes, but it's like my weaker side. My left leg is my starting leg.
Good. Switch sides. Yeah. It's really
That's
common
right.
that we have one side that is harder than the other. So
Feel like if I just relax.
You need stability with the
Yes.
work shoes.
Yeah, I
You're
do.
wearing running shoes.
100%.
They're like sexy, but
Yeah. Like when I'm running long distances in there.
Very
yeah, you
unstable.
So that means every time we're
I'm gonna
planting
see
that
that.
foot on the ground,
I don't know
that
which ones.
instability
The only ones that don't hurt me
doesn't
are
allow
those
us to
ropes.
access the
Yeah, the
muscle.
ropes are the ones that I have.
Okay. And
They're like a seafoam green.
Yeah.
They're specifically for stability.
Is there soft at the bottom?
Everything else.
No, what your Brooks are, my Brooks seafoam
Yes.
green ones are stability ones.
Even
We
less
have
so
an extra support here to
walking,
keep you from running
hiking,
in. So they make
single
sure that.
leg things,
These
right?
don't have that
Meaning
at all,
that
because
foot is not
this
doing
is
its
like
job
flimsy.
above
There's
it.
only like 3 of them that have it.
Foundation.
Yeah,
muscle.
so you need a stability shoe.
Good.
He'll get a paycheck otherwise,
Right.
but you need the shoes get fine.
Yeah.
The right shoe matters too.
So, first and foremost, take foot exercises slow. Do not blow your feet up doing some exercises like this. And then, because if I do a ton of bicep curls and my arm is fried, the next day I can take a day off using my arms. Can't do that with our feet, right? Sometimes people go too hard at these exercises and then they're like, feet are absolutely fried. So what you were talking about, where you were getting sore, was this muscle called the soleus.
Yes.
The back of the calf. We have our main calf muscle, gastroc, and we have soleus below it. Both of these tie into our Achilles tendon.
Okay, now it makes sense.
Research has shown that when we're running, this soleus muscle sometimes needs to handle 9 times body weight, especially with something like sprinting.
Okay.
So this muscle does a lot for this stability here. We need to be able to create this really strong, stiff lever that we can generate force off of. So if you start to feel a lot of activation here, especially into this, that's exactly what we wanted. Cool?
I mean,
So-
I don't know if it makes any difference or not, but my calves are always so sore.
Like,
Right.
but like this
And
part
I
is
understand it's
not-
running, but I mean, like they hurt to touch, yeah, like all the time.
Yeah.
Running.
Some area where we hurt, we compensate from, right? So if we're running on a foot that's doing this, the calf is not able to do its job the right way, and it has to
Okay.
kind of figure it out, and it gets pissed because it's trying to figure things out. So, cool. Questions on that one? So kettlebell passes, so we call them. Start with like 20 to 30 seconds at a time. Take it slow. I usually like to do 3 to 5 sets. Eventually, for me, this one turns into like one of my warm-ups, personally. Like, I've done them a lot. So if I'm gonna do like a leg day, this is a great one for warming things up and starting to build that like arch stability. Plus, we've had like ankle injuries in the past, maybe you've rolled your ankle or things like that. This is a great exercise to build up that lateral control. Cool. Questions on that? Okay, so we're gonna try 2 more. We'll see. So we're gonna do pogos. So pogo. This is how we start to create more and more of a spring for our foot and ankle. So we're gonna use the track here. We're gonna go 10 forward, 10 backwards. Hands go on hips, and what we're gonna start to think of is my feet doing this. Think of this like a plyometric for your foot and ankle only. So we're looking for the whole ball of the foot, right? So all of that activation you just got, I want you to try and find as we do the pogo. And so the pogo is not a jump, pause. It is going to be a, kind of like a kangaroo. We're going to about 10 forward, and then about 10 backwards. I'm trying to pogo off of what we just worked on, the ball of the foot, and creating this spring.
You're muscle plantar flexion the entire time. There's no, you weren't getting that.
I'm trying to just create the stiffness. So I'm not staying up like this. I am trying to keep foot a little bit more neutral. And it's like my foot slapping the ground. My heel is going to just barely touch the ground. It's just gonna kiss the ground and back up. Kiss the ground and back up. This is one of my favorite like low-hanging plyometrics for the foot, because it's just foot and ankle. It's teaching us as we're running to be able to create that spring. So one more time, hands on hips, knees stay nice and soft. There's no knee bending, but we want to just keep a little bit of activation, and we're just gonna go. When we start this, it's normal for a pogo to be maybe a little bit lower. As you progress it, it's the same movement, it just creates more amplitude.
Of course I'm gonna try that first. My ego will do it.
Cool. All right, give it a shot. Pogos, 10 reps forward. Think about your foot slapping the ground. Equal pressure across the whole ball of the foot. So we go 10 forward.
No, I forgot. Oh, no, you're going backwards. Sorry.
No worries.
Okay, so here.
Knees stay straight. Find the balls of the Find the balls of the feet, not the toes. And don't worry about a big jump right now. Keep it small, but keep it springy. Boom, 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 boom.
Stop following me.
My legs are so tired. I'm in the same boat like that, feel ya. Okay.
Heels barely touch the ground. And just
Am I even doing this right? It feels very awkward.
That's how I felt.
So,
I feel like we got to.
Like, are my knees too
yeah,
bad?
you're gonna feel the pressure on this.
I
Like
feel
a
like,
potato, like a chunky potato,
I
right?
feel like right here. Yep, right there.
This
Right,
is,
feel it?
so give it a break. This is what I want you guys to think of. Slap the ground.
Well, my calves are tired from whatever I did, so.
Same, my like
My
sides.
calves and my butt.
Yeah,
I
butt.
feel this in my butt.
Yeah,
Okay, so I'm doing it right?
perfect, yes.
Oh, there you go. I
Yeah.
feel the perfect butt exercise works.
Yes, okay, perfect.
You'll feel it in high glute, or
We're
low
gonna
glute,
take
hamstring.
it last tomorrow.
And a lot of calves. So think about this as you're going. It's not my foot just doing here, as if I'm jumping rope. The foot is trying to slap the ground and propel up. Slap the ground and propel up. So
Compelling. One at a time, makes.
the difference, this is not the pogo, this is me just hopping. This is, see, I'm trying to slap that. It's a tough one. Let's give it a shot. And I like hands on hips, soft knees. There you go. There, that's getting better. Good.
I'll pee my pants.
Keep core, brace with breath. Knees nice and
That
soft.
actually kind of burns.
Feel the high?
It does burn in my side butt.
Yep, side butt. We're growing butts today.
Growing butts today, doing foot
So,
exercises.
we're growing some butts.
Oh,
Good. Take these plyos slow. These plyos are not meant to be like a metabolic conditioning. They're meant to be
I know, I'm like, damn, but I'm out of breath.
springiness.
That's my PSI.
Yeah, right. So, pogo, super simple. I've done them for a while, and I do the same exact version you guys are doing. I just try and, for me, add way more amplitude, just because I've done it for a long time. Patients will typically start here, and then again, it turns into,
I guess I just don't have very strong feet.
equals to.
Yeah.
Yeah.
So I broke this ankle at the growth plate when I was in first grade. So I had 3 surgeries on it. You can kind of see it. But this one always struggles more than this one. I don't know if that has anything to do with it.
For sure.
It's also smaller.
Yeah, that one overpronates a lot more.
Yeah, this
So,
one goes like all the way.
Yeah, so that's gonna
We need to go get you some orthopedic arches or
Uh-huh.
something to fix your.
Dr. Schultz.
build.
Like if I relax, this is what my feet do.
Yeah. Once you build the arches up, your feet will naturally just sit into a good position.
Like I have to actively make my feet do this.
Yeah.
But now that once you start thinking about that, it becomes easier, because ever since she told me about my dumb toe coming up all the time, now I'm like, when I am running, I'm consciously trying to put that.
So like if I actively
Good.
hold them up, will it help eventually?
Yes.
Okay.
Eventually it'll be your new normal. Right? Think of it like this. If I start doing bicep curls to get my bicep bigger and stronger, if I do it once, I'm like, yeah, that kind of didn't help. But if a couple times a week I'm doing bicep curls, I'm making it stronger and doing more, eventually it's going to change.
Right.
It's the same thing, your foot and ankle. But people tend to think it's just this thing you can't.
So funny. I literally had a doctor tell me that I was born that way, and that was how I had to be. That's crazy.
No, don't.
Because I was like, really?
Yeah, no. And then the more, what happens is people get orthotics, they get support, they get big squishy shoes, and it makes it worse because we're making the foot weaker and weaker.
So that's worse for me. Yeah.
That will make your foot feel better. But
It doesn't really though. Not if it's for a long time.
yeah,
Like if I wear those all day back here, I won't be able to feel them.
yeah. So the more we support the more we support our foot with something like this, it doesn't bend. Our foot is made to bend. It doesn't rotate. So much cushion underneath. The toes are getting jammed together. The toes need to be able to spread out. If my shoe doesn't move, my foot's not gonna move. And you're just casting your foot all day. Casting your foot all day eventually turns into ankle, knee, hip, low back pain because it just gets weak. I said earlier, like everyone has a leg day. No one includes foot and ankle with their leg day. It's literally the thing that transfers force from the ground. It's your foundation. If you have a weak foundation and my ankles are dropping like this, you can do quad extensions or squats all day, but like foundation's jacked. So, and people think, and it's not your fault. A lot of people go to medical doctors or podiatrists like that, and they hear that, oh, you just need arch support. We put you in, and then they, oh look, it fixed your arch, but they just made it weaker, right? If somebody came to one of you guys as a trainer and said, my core is weak, and you're like, got the fix, let's wrap it up, let's give you a core brace, you'd be like, that's like, absolutely not. We're gonna get your core stronger and make it do its job. Same thing with foot and ankle.
So the shoes that I wear here are normally not like, they're like super flat, super flexible.
Oh yeah, I know.
The toe bones, yeah, my white ones, like
Yeah.
the white toe box, but they're super flat
Great.
and super thin, and they like, should I be wearing that all the time instead of my favorite trail shoes that I feel like I'm not gonna fall off and not me?
Yeah. Yeah, because, well, and it becomes patient dependent, right? Some people don't
Yeah.
want to switch shoes and they're like, I'm fine with it, which is fine. I personally, like wearing a Brooks or something like that, especially like, sorry, I'm picking on you.
That's totally fine.
With your history of like the foot and ankle and how much it collapses, eventually you're not gonna be able to walk barefoot.
I was just about to tell you, like when I just like jogged to get my drink, my feet feel so weak. Like it's so hard to run without shoes
Yeah.
or walk.
Or walk, and then eventually you're going to be tied to that. You're young, so you're not getting a lot of pain, but eventually that turns into it. So to kind of answer your question, personally, I don't want my body to have to rely on something to just function as it should.
Right.
This is why I wear my Air Jesus shoes. I don't care that they look ridiculous, and every other person's shoes
At
does.
least you know.
Like, yeah.
Right,
Like,
yeah,
I don't
I'm
care.
actually laughing at you.
Right.
Okay.
And so, but those, understanding that or wearing a more minimal shoe just all the time gives your foot that control. So everything above it works well.
Which, funny enough, when we did that run, that's what I was wearing.
When you did High Rocks?
Yeah, it was the first time like my knees didn't hurt, because I changed out of so many hiking shoes, running shoes, because my knees hurt. When I ran or hiked, like nothing hurt.
Yeah.
I'm like, I should be dying. Everything should feel awful. I'm wearing these horrible flat shoes to run in, but nothing hurt.
That makes sense.
Well, it's like humans have been around for thousands and thousands of years,
Without
right?
fancy shoes.
Without it,
It's only since
Air
Nike
Jesus.
came
That's
in,
when we were born.
this and this, right? And then they kind of fucked it up. So anyway, let's talk about running form. This is a running thing. Heel striking. We talked about this earlier, right? Patients come in or they wonder why their knees hurt, and we watch them run and they're going, don't know why this hurts my knee, right? And they're landing every time on their knee. So they're taking all that impact into the joint. Versus, we take a proper forefoot strike. Now I take that impact out of joints into muscles, where it's supposed to be. Once your foot gets used to it, running is so much easier. It's way, way more efficient because we actually use our built-in mechanics for the foot. Has anyone read Born to Run?
I think I have that at home. I don't know that I've actually read it, but I have it.
It's a great book. It's about I read it years ago. It's about a Mexican tribe of like people, and they run like marathons a day. All of them, like up to like 70 years old. It's just they're nomadic, they run, and they're literally, shoes look like that. Piece of leather strapped to their foot. In watching them run, it is a forefoot strike, land, propel forward. If I run in those and I land on my heel, I know. With one strike. If I go and I go, oh fuck. Okay, let me change this up. I'm gonna run on the forefoot. A squishy shoe, you don't get that feedback. I can land hundreds, thousands of times on my heel, and I don't feel it because it is supported. So, over time, this is why running is high impact. It's not high impact, it's just high impact if you do it wrong. If every time I do a box jump, I land on my heels like this, I'm like, that's high impact versus landing, right? Big difference. So, let's do running form. Come on over here. Let me use the track. Okay, so running forward, the best way I like to teach people how to do this, one, we've built in that lateral stability. We have kind of an understanding of what the foot should be doing, we're gonna over-exaggerate our running form from here to there with high knees. And the high knees are eventually gonna get lower and lower until they're just regular run. So I wanna think of my body as falling forward. Everything stays in alignment, and I'm just falling, and my legs are gonna catch me, and we're gonna start with this high knee where foot's gonna come up, heel's gonna kiss the ground, and then we're gonna come back up like this. So the first one, here to there, is just gonna be a simple high knee. Once we get all the way down, we're going to start with the high knee, but start to make the knees come lower and lower until it becomes a smaller. So high, middle, a little bit lower. My heel is touching the ground, so I'm not running on my toes. This is going to give you tendonitis. My heel with that is, first of all, as you guys are landing, my foot is landing underneath my center of gravity. So this is what helps, why the high knees help, because it helps teach us to land here. If I am ever reaching for a step, it's going to be a heel strike, and I'm loading, my weight is not underneath me. Right? I wouldn't do an overhead press like this. I wouldn't want to load all the way out in front of me here. Plus, I'm technically running with the brakes on. So I need to land forefoot, and then what's going to happen is we want that quick cadence. When we have that quick cadence, it makes it more efficient because we use the properties of the myofascia. If I quickly stretch and try and contract the muscle, the myofascial has a stretch reflex response, where if I stretch it really quickly, it snaps back like a rubber band. If I stretch it and I have a slow running cadence, I lose the snapback, I lose the elasticity. So if I step, plant, pause, and then step, plant, pause, I lose the snapback of it. But if I'm quick, I don't have to use as much energy because I get the elastic property of the fascia. This is what this is starting to teach. So, same drill, down and back. So honestly, it's going to be hard to get to your 180 cadence here because you're going to go very fast. That being said, try high knees at first, and then just try to get to that. A little bit quick. I'm not trying to run fast there. I'm trying to find this. So high knees to start, and then a little bit less. Cool?
Yes, sir.
Let's see it.
You're up. Good. Go
So
on.
you're in my head multiple times a week. I'm around the house barefoot.
Okay.
Yeah, there you
I
go.
go,
All eyes on you, girlfriend. Hi,
I want the shoe. And
High
I'm
knees.
like drawn to, I've got these front house slippers. They're just worn down.
Think high knees.
So exactly what you're saying.
I
I'm
feel
becoming
like I'm
dependent.
like-
And
Yeah.
I'm a little older than that. So, yeah, my body goes, hey, fix this.
Mm-hmm.
Compensate.
Mm-hmm.
Damn you.
Getting in there. That's great. That's right. Yeah, that's spot on.
I hold that 180 to 186, so that's why like Melanie and Cyrus and them are like they always want to run together because they're like they stay on that like pace.
That's good.
But,
How did that feel?
it feels pretty good. I mean, when I'm paying attention to it, it's helpful.
Look up, Dave, look up.
Nice and tall on that. Don't let head come forward or else the lower back is going to compensate. Oh, okay, gotcha.
Watch the knees, watch the knees. Here we go.
They're not going anywhere.
Yeah, great.
I did bring my whole target home for the record.
Pardon me.
Arms pumping. Yeah, there you go. Good. Right now, it's going to feel like we're kind of taking these little steps. once we have actually more space, we'll be able to get into more like hip drive and then step forward. Hip drive, step forward. Right now it's going to kind of feel like we're like tiptoeing. Eventually it just gets into more of a normal pattern.
Too, like if you're when we leave here, because we'll be leaving in a minute, like find an 180 beat per minute song and play it if you're listening to it.
That's a good one, yeah.
Focus on dum 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 dum.
Yeah.
It's like totally against everything I learned as a runner and a
Where
swimmer.
there's even those songs
I don't
that are
even
just
have
the
like
beat.
a runner
Yeah.
knowledge. I just kind of run.
Yeah. A lot of people do, and then they hurt their knees. Or, you know,
So many things.
they get running shoes,
So bad.
and the running shoes literally make you run wrong. So, again, it takes a while to learn to do these things. It takes a long time to build up foot and ankle. The longer I do this, the longer I work with patients on foot and ankle, the more I'm like, oh,
I'm excited to do this.
it takes
like,
long.
and just see how much that makes a difference.
I'm excited
Huge.
to know that I can fix my issue.
Yeah, that's
Yeah.
pretty cool. I'm taking that home
I thought I was just permanently this way.
No, and it's too bad that a lot of healthcare providers
So
tell
why do they
people
do that?
that.
So they can prescribe like insoles or?
It's part of their training. They don't really realize that they can not.
Okay.
2, they don't have enough time or maybe knowledge to understand that you can build up an arch or you can not have these types of things.
My dad has really flat feet, and so I just always assumed it was from him.
Yeah, your foot moves and you built the arch whenever I cued you into it. Like,
It's not incapable.
no, absolutely not. And so that's a good point. People think like, oh, I have bad knees because my parents had bad knees. Like it's some sort of genetic factor, which there is some genetics that go into it. But most of the time it's we watched our parents move when we were younger, and then we inherit their movement patterns.
Okay.
If your dad always wears big squishy shoes, if he's always never barefoot, you see him every time he,
used to only wear flip-flops, which is so funny. But yeah, now he just wears big squishy shoes.
flip-flops aren't great either.
And he's a runner, so like he runs like 10, 15 miles every day. So yeah.
Yeah.
And he keeps complaining about his knees, and I'm like, huh.
Yeah.
Mine's more like tendon. I feel like a lot of times I get mine more in like that patella area.
This will help a lot. Yeah.
So my toes are always out, always, always.
Uh-huh.
I consciously turn them straight because everyone's like, keep your feet straight, keep your feet straight. My knees not. So like,
It's your hips.
yeah, there's issues. There's issues.
Yeah.
I broke my sacrum. I have a left hip injury. So like I have a lot of stuff. So should I not really concentrate on trying to fix that because it knocks my knees in, or like?
Getting your foot stronger as we turn forward will prevent the knees from collapsing in like that.
Okay.
Yeah.
Alright, so just keep working on that.
Yeah, work on these 3.
How often should we be doing this? I took some notes. Should I be doing this like every couple days? Should I be doing it
3 times a week.
3 times a week?
I don't like to do any more than that.
Okay.
3 is like max because you can hurt foot and ankle. Like for you, 3 is probably fine. For others, I do like once, maybe twice a week. Just because
Is it normal to wear tendons like that? Because I love that.
any shoe that we have to grip our toes like this to hold on our foot become an issue. If we have a back to it, or as we step, we need to be able to spread.
That have the back strap, you would probably be okay, right? Because then that's holding it on. You're not.
Like my
You're not
Yes, if
gripping.
you're talking, but the Chavas have those too. So if you get the Chavas with the back strap, you don't like the Chacos either.
They're just too squishy. They're very thick. They have arch support in them. The brand, the Zeros, they have
They are ugly, but they're awesome.
Is that who makes that? Zero?
Zero,
Dr.
zero with an
Pete's
X.
gonna order me a pair of these things.
They have some that look like Chacos, but they're just flatter. But they look exactly like a Chaco.
And where are they?
Are these like a specific? What are these called?
Brand Zeros.
Oh, zero. I have Zero shoes. Those are my weightlifting shoes. Or Zeros.
I wouldn't know.
Yeah.
They're not cute, but they are good. for Zero weightlifting.
Oh yeah, they're great.
Okay.